My presentation is on the history of insane asylums by Cara Kramer. The first facility to open up was Eastern State Hospital in Williamsburg, Virginia. This hospital opened up on October 12, 1773, and is still operational today. It is the first national public facility built with the intention of solely treating patients with a mental illness. The building has 24 cells for male and female patients who were dangerous but had a chance of being treated. Some of the treatments available at the hospital were restraint, strong drugs, plunge baths, shock water treatment, bleeding, and blistering salves, as well as electrostatic machine. 20% of the patients who lived there were cured and discharged between 1773 and 1790. Some of the common treatments of the 1700s through the 1800s was purging and bloodletting. Bloodletting is the removal of blood for therapeutic purposes. Other treatments included dousing the patient in either hot or ice-cold water to shock their minds back into a normal state. There is also blistering, physical restraints, and threats, as well as an invention called the gyrating chair. Dr. Benjamin Rush invented the gyrating chair. This instrument was intended to shake up the blood and tissues of the body to restore equilibrium, but instead resulted in rendering the patient unconscious without any record or recorded successes. Dr. Benjamin Rush was an influential physician who tried to establish humane conditions for the treatment of the insane. He was also known as the father of American psychiatry. He believed that insanity could be cured by bleeding and purging. As mental health asylums gradually transformed into institutions that went from confining those with mental health disorders to treating them, psychiatrists began experimenting with different therapies for treating a range of diseases. Many of the early patients of the new psychological revolution did not have quite the range of options available to them, so many of them resorted to testing out the experiments. One of the experiments was electroconvulsive treatment, better known as shock therapy. Although the practice continues to this day in hospitals around the globe, its efficiency as a treatment for psychological disorders has been questioned by the medical community. Another treatment was the lobotomy. This is among one of the most brutal and infamous treatments for mental health conditions. The process involved a surgeon intentionally causing trauma to the prefrontal cortex, which is the part of the brain that deals with behavior and personality among other functions. Ever since the invention of the lobotomy in 1935, the treatment has sparked controversy over its effectiveness and sheer brutality towards the patients. Many of them who underwent this procedure were left permanently incapacitated, some even died. Other types of therapy included hypnotism and art therapy. Hypnotism was another form of psychiatric diagnosis and treatment. Hypnotism predated psychological study but was first described in clinical terms in the 19th century. It is still practiced today for sleep disorders, nicotine addiction, depression, and a whole range of diseases and conditions. The other form, art therapy, is shown in the photo on the top right. This is a painting that shows the product of a patient's therapy, which provided medical professionals with an insight on the patient's conditions. Art therapy was a window in which through the patients, along with their therapist, could examine past traumas or challenges that they wouldn't have been able to approach otherwise. As patient care became a high priority for mental health professionals, as opposed to simply corralling patients into a facility to segregate them from society, what were once called lunatic asylums gave way to psychiatric hospitals. The 1980s marked a period in which sweeping budget cuts led to a decline in services for the mentally ill. So as psychiatric hospitals closed, insufficient funds were provided for community care and residential programs, leaving some mentally ill without proper treatment and with nowhere to go. Many of the mentally ill today reside in prison because they were often had no place to go and would stop taking their medication or could not get a hold of their medication and would end up committing crimes to because of their symptoms. So many today still reside in prisons, which over half the population of inmates are mentally ill. These are some of the references that I use throughout my presentation.